Hello, it's Dr. Claire here, and today I'm going to be talking to you about anal glands. Look, this is probably a vet's least favorite part of their day, but it's important in ensuring happy, healthy dogs. Anal glands, or anal sacs as they're sometimes called, are two pouches on either side of a dog's anus. They're at the 4 and 8 o'clock positions. Anal glands empty their fluid through these short canals. They produce a oily kind of brown liquid, and it has quite an awful smell. Some people describe it as fishy and others as musty, but I think we can all agree that it's pretty unpleasant. The anal gland fluid contains pheromones, and dogs use that for territorial scent marking. And it's also thought that it has a lubricating function. The idea is that the anal gland fluid is expelled when the dog defecates. But if this is not happening on a regular enough basis, then the fluid becomes thickened. This thickened fluid is harder to pass, and then the anal glands become impacted and infected, sometimes even abscessing and rupturing. So why do anal gland issues happen in the first place? Well, that's a really good question, and there is a few contributing factors to consider. Dogs that are overweight and that have a low fiber diet, and so consequently soft feces, tend to have a problem with their anal glands. And there also tends to be a genetic component. Some breeds of dogs are born with anal gland problems because their anatomy prevents the glands from easily expressing. So keeping your dog at a healthy weight and on a complete and balanced high fiber diet is really important. You'll know when your dog has problems with their anal glands because you often see them scooting along the ground as if they have worms. Some also are reported to be itching and scratching and licking the area more often, and others seem uncomfortable when going to the toilet. It's important, if you see any of these signs, to get down to your vet to have them checked. Because as I said earlier, if they are blocked or impacted and there is an infection, then they can abscess and rupture. Some dogs even require surgery. If you suspect your dog has anal gland issues and you get it down to the vet, they're going to do a rectal examination. So this is where the vet can examine the shape and size of the anal gland and also check if there's any evidence of infection. If they are infected or very inflamed, then the doctor might prescribe anti-inflammatories and antibiotics. As I mentioned, these problems vary from dog to dog. Some dogs are in every couple of weeks, and other dogs never have to have their anal glands checked their whole lives. In severe cases where there's abscessation or impaction, which is happening on a regular basis, sometimes there's cancers associated with anal glands. Well, those cases often need to go to surgery. In this procedure, we remove the entire anal gland, and it can lead to some excellent results for these patients. You should speak to your vet in detail about this procedure because, as in all surgical operations, there are risks. Certainly not the most glamorous of topics, but important all the same. Thank you for tuning in.